Thank you for having me. Yes, so I think that I'm going to address this in two ways. One way is the pre-pandemic way of what should be done, and the other way is the peri-pandemic way of what can be done. And in the pre-pandemic world, what the best recommendations are really to form a team of people around the patient with diabetes at risk for amputation, and that team consists of multiple members who have various levels of expertise, and it's not really based on your profession. It's more based on who has that expertise, because in different parts of the world you might have a vascular surgeon doing revascularization, but in another part of the world you might have an interventional radiologist or interventional cardiologist that is the go-to person for reperfusion. And so it's really about certain skills that are needed on that team in order to prevent amputation. And also, if we look at the stairway or the natural history of how somebody with diabetes ends up with an amputation, it starts, of course, with diabetes, neuropathy, and then usually there's a foot ulcer. And that foot ulcer then, with or without vascular disease, may become infected, but it's almost always the infection, which is the coup de grace, the final blow, that leads to the amputation. So we look at that natural history and we say, how can we intervene in this natural history in order to prevent the ulcerated foot, or even the foot from becoming ulcerated, from being amputated? So that has changed completely during the pandemic, because the pandemic has affected team-based care. So we know from dozens of studies that have been published that team-based care, which, obviously we're here speaking at the Association of Podiatry meeting, and that team-based care always includes a podiatrist, either by specialty or by profession. But that team-based care is being disrupted during the pandemic. There have been several studies that have been published, and I reviewed these in an editorial I wrote a few weeks ago titled "Diabetes-Related Amputations, a Pandemic Within a Pandemic." And in at least 4 studies, we have seen a drastic increase in the risk of amputation during the pandemic, even upwards of 10-fold in Ohio in the United States, because of the pandemic, disrupting this team-based care model, and also with the impact to patients delaying their treatment by trying to avoid the healthcare system, to avoid becoming infected with COVID. So during the pandemic, we have to focus more on a virtual team. Almost like I heard Pauline Wilson talk about she normally takes a picture when they get together, and she has been forgetting to take pictures of all of her virtual meetings of the team of experts that get together to help make these consensus documents. But we have to do the same thing in clinical care now, and we're employing new methods, telemedicine, virtual team consults, all of these things to help improve the care to our patients, and bring back some of that team in relation to the prevention of ulcerations and amputations.